So yes guys, we are back with another reaction video. Today we will be reacting to another rare medical condition. This one here should be interesting. So let's dive right into it and see exactly what it's about. I'm seeing here happy birthday. 19 years old. Okay, so he's a 19 years old guy.
I'm one of two people in the entire world that have this mutation, this disease. 1 in 4 billion. It has been very difficult.
1 in 2 people in the entire world. Are you crazy? I don't even know if I've ever heard of any disease that is something like that. Like, I've never heard of a disease that's so rare like this one here. I'm not too sure exactly what he's talking about, but we're gonna find out together, guys.
Difficult for me to describe my disease to a stranger just due to it being so complicated and something you wouldn't expect.
Happy birthday to you.
1, 2, 3.
Living with the rarest of rare diseases.
I have a incredibly rare disease, progressive, at the moment, untreatable. We don't know what the future holds, and that's scary to think about because I have lots of plans, lots of ambition, lots of things that I want to do in life.
Mitchell Herndon has a disease so rare doctors don't even have a name for it.
That goes to show you how rare it is, guys. That even the doctors don't have an actual name for it. But it seems like he's doing some sort of physical therapy there, so most likely the disease has to do with some sort of like mobility. We don't know exactly what it's about, but we're gonna find out soon. So let's keep on watching.
He can't feel hot or cold below his waist. He can't feel pain or pressure, can't walk, and suffers from hearing and vision loss.
So his entire body is actually affected, but from his waist down, he can't feel anything. That's actually pretty strange indeed, yeah. And I can imagine too, because he seems like a normal, good guy. It's just that he can't really function because of the actual, I don't know what condition it is, but the mobility, like I said. And it must be tough for him, man.
I went to Philadelphia, Alabama to see specialists. My blood and my DNA has been sent to Europe. I've seen neurology, immunology, radiology, I don't know if that counts, rheumatology. I can't even give you a good explanation of what rheumatology is.
That's actually surprising. Like, you see, when you have a rare medical condition, you have to get a lot of specialists involved because you don't know if it's some sort of neurological problems. You don't know if it's some sort of like structural skeletal problem. You don't know what it could be. So you have to get specialists to look at everything. So it's really tough, man. I really hope that we see like some sort of happy ending to this video, or at least potential of a happy ending. But let's keep on watching and see what it's about.
It's noon.
And yeah, guys, rheumatology, if you don't know, it's a specialty in medicine which deals with musculoskeletal diseases, autoimmune diseases. So it's a really, really amazing specialty. Whenever you have like joint issues or mobility issues, usually you check out a rheumatologist as well to make sure that everything is good.
And this is the morning. Just lots of pills.
So you have like medicine for if you feel nauseous or sick to your stomach.
Yes. It used to be a lot more, but I've gotten used to it.
The pills help address his muscle spasms and other symptoms.
Strength.
Also, apart from the actual symptoms they told us about in the video, apparently he experiences other things like internally, because he did mention muscle spasms, vomiting, nausea, and so I can see why he needs to be taking these medications. But of course, like I said, that's tough because for a 19-year-old having to be taking medications every single day, that's physically and mentally tough, man.
Twice a week, occupational and physical therapy helps strengthen his upper body and leg muscles.
Okay. 1, 2, Thank you.
Okay.
Can you move it back so I'm in the corner over there? Thank you. I don't know if I'll be wearing those out in public, but I'll wear them around here. No, this is... I knew you were gonna do that.
You sent to the corner.
See, it's not just me that tries to be funny on TV, okay?
Mitchell's condition has been a medical mystery since symptoms first started to appear at age 12.
Oh, so he wasn't actually born with all the symptoms. I thought he was born with all the symptoms, and then it just either progressively got worse or it stayed the same. But apparently he was a regular, normal, active guy. Shucks, man.
He was your typical kid. He had some asthma when he was younger, but no other medical problems ever.
I had always been a very athletic and active child. So the first things that I noticed were just difficulty running, difficulty being athletic.
When Mitchell was 12, he first came to us and said he felt like his legs were weird. So I took him to see a neurologist at St. Louis Children's Hospital, which actually I'm a nurse at the hospital, and I felt like they could solve everything.
That's the thing, because when you see a child suddenly starts to get problems, usually you don't really expect it to be anything serious because they've been so good for so many years, and then suddenly something so drastic happens. Like, it's very, very rare, man.
One of the top pediatric hospitals in the country, and all of a sudden these neurologists are telling me we don't know what it is. And I kept thinking, what do you mean you don't know? I would see the tests that the doctor was doing, like checking for reflexes or checking sensation, and you just like have this pit in your stomach of he's failing all these tests. What could it be? Lab tests for the diseases they were testing for were all coming back as normal. That was frustrating and confusing.
Yeah, once you see the lab tests and everything starts to come back normal, then is when you start to worry, like, what's really happening here? All of his lab tests are normal here, but yes, he's going through serious, serious problems. We did a physical examination. Nothing seems to be wrong or weird, but we don't know what's going on. Why is it progressively getting worse? And that's when things start to hit the fan, because you don't know what to do. You're completely lost.
And you just want a diagnosis so bad, and you're having to hear the doctors say, we may never get one, we may never have a diagnosis. Yeah.
We checked for everything from infections to cancer to any type of autoimmune problem that it was already.
Assistant Professor of Pediatrics, Baylor College of Medicine.
A known disorder. He had a problem with parts of his spinal cord, and the nerves were not working properly there.
It wasn't until Mitchell joined a network of doctors and rare disease patients that they began to crack his case. The group is called the Undiagnosed Diseases Network. It studies patient symptoms and genetic data in order to find diagnoses.
When you're dealing with rare diseases, if you are able to find more than one patient, it sort of strengthens your data.
That's true, yeah. Once you can find more people with similar symptoms and so, it's going to help you out. Of course, better research, you'll be able to better understand faster and quicker. You'll understand exactly what these people are going through. But if it's just one person you can test, you're not even too sure if you're doing the right thing or not. But it's good that they actually have places like these that specialize in just rare conditions, man. We really need more places like this in the world.
And your understanding of what's going on, that's what happened in this case.
6 years after Mitchell first became sick, the network found the only other patient with Mitchell's symptoms and the same gene mutation, a match to a 14-year-old girl in South Korea. This discovery led to Mitchell's diagnosis in March of 2018.
Mitchell's diagnosis is that he has a novel disorder that's caused by a change in the gene for ACOX1.
ACOX1 is an enzyme, and it performs the most important step in the path to break down fats inside cells. In Mitchell's case, a mutation of the ACOX1 gene stops the ACOX1 protein from working properly. This leads to a backup of waste products in Mitchell's cells, and that damages them, creating a chain of events leading to nerve damage.
That's crazy rare, man. Guys, I don't know if you understand how rare that is, but for a problem like that to happen, that's crazy rare, man. I've never heard of anything anywhere close to that. So now that the cells have a problem, it's actually the problem with the enzyme. It's not working properly to break down the waste. And because the waste is not breaking down, you end up destroying the cells because the waste accumulates in the cells. It's tough, man.
I think at first I had relief, like, oh, we know what it is. But then there was just even more just confusion and frustration because just because we know what it is doesn't mean all of a sudden he's going to get better. It's not like we can Google ACOX-1 and come up with anything. Like, we would get 0 hits because it's so rare.
It had been so long since I had really ever thought about or cared if we ever found something, because I had kind of resigned myself to the fact that no one would ever really find any answers. I had just accepted that was the.
There's still times where you never know because the medicine is rapidly expanding, so you never know what could happen. We gotta wait and see what happens.
It was. So I was kind of shocked in disbelief that we had really found anything.
In the last year, Mitchell's neck, throat, and diaphragm have been getting weaker, making eating increasingly difficult.
Oh, I thought that was beef bacon. It was sauce.
Although he has a diagnosis now, doctors are only beginning to study his disease, a reality he has to live with.
The next generation of people.
Another thing, you don't know if it's gonna get worse or not. Because how it's looking like right now, it looks like it's gonna get worse. Because they mentioned that he's struggling to eat as well, to diaphragm not functioning properly. And of course that's gonna affect breathing as well. So I really hope it doesn't progress further and they actually find some sort of treatment. Even if it's not a cure, at least treatment to make him live a better quality, a higher quality of life.
With that problem, they get all of the research and all of the ideas and new medicines and treatments that I won't get. While I'm happy to be the guinea pig, I would rather not be the guinea pig.
I don't think I ever said, why me, God? I think I more just said, why anyone? Why would you put anyone through this? Why would you make any mother have to watch her kid go through this? Or why would you make any teen have to go through this?
Stuff, yeah.
And I don't know the answer yet. One day, maybe I'll find out. There are...
Yeah, sometimes we don't know exactly why certain things happen to certain people. All we can do is do our best. That's all we can do. And just hope that in the end, when everything is said and done, we get the answers we're looking for. That's all we can do.
Good things that have come out of this. Like my middle son, for example, is very compassionate. If you think about like muscular dystrophy, they have this massive muscular dystrophy association. Charity walks and runs for cancer the Leukemia Lymphoma Foundation. They have all this support, and I'm glad that they do. But when you're like one of two, you really don't fit in anywhere, and you're like trying to find support wherever you can find it.
That's the thing. And I'm pretty sure that there are more people like this in the world, but mainly in the third world countries, because in the third world countries, people don't really focus too much on these type of things. Like if they see a problem like this happening, they're just gonna call it something generic and leave it as that, or they might not even look into it further or just continue living their life. So I'm pretty sure that there are more people like this out there. I'm pretty sure, but it's just not documented.
I've gotten very, very good at being positive and putting a mask on and at being strong. I'm not always like that on the inside, and I don't like showing weakness almost, but it's really hard. I want people to know that I deal with a bunch of crap. It's a lot. It sucks.
I can imagine, man. He's doing a really good job of hiding, because in his face and all these interactions here, interviews, I've never seen like depression or like despair or sadness, man. Respect to him.
Mitchell was enrolled as a freshman at St. Louis University last fall, but a few weeks into school his body relapsed and he had to take a leave of absence. He hopes to return soon.
A 19-year-old college student is obviously surrounded by the dating scene, and that's definitely something I'm very interested in. But it's also very scary for me that has caused a lot of pain and sadness in that I'm very different. I have lots of problems. I'm gonna have to.
But I'm happy he's like, his parents are forcing him to live a normal life though, man. It's really important to make sure you don't isolate them. Let them try and live as normal life as possible, because you don't want them to be isolated.
Find a very special girl that is okay with those and that loves me for who I am. And I'm very hopeful that I'll someday find someone to love me like that and be able to be a father and raise children.
He has really great hopes, man. I wish him nothing but the best. He has really great hopes. But I'm sure he's gonna find someone, man. Trust me. I'm sure he's gonna find someone.
Great, so cute. Okay. Go and get your poster.
I hope that by my unfortunate situation, I can help bring out the goodness in others around me.
And that's the thing too. He's mentioning a very, very good point here. His condition, his situation is gonna help the next person who is experiencing the same symptoms. Maybe in the next 5, 10, 15 years, they might find a cure. So that's sometimes how God works. Unfortunately, certain people go through certain suffering because he wants to showcase his goodness and help them to be the first individual. He wants to help them to be the first example so that cures and treatments can be developed so that others don't have to go through the same problem that this guy is going through. Because there are many, many other conditions that people died from years ago, 10, 15, 20, 100 years ago, that we now have simple medications for. So sometimes it's unfortunate, it's very unfortunate, but sometimes there always has to be that first person. And that first person is going to help the entire world because they're going to help push science forward, push medicine forward.
Hopefully in myself as well.
So yeah guys, that's the video. I do hope you guys found it insightful. I do actually have another video like this, another reaction video that you guys are going to really like. You can go and check it out right here. But yeah guys, thanks for watching. If you did like what you saw, please don't forget to leave a like and subscribe for more health and wellness videos like this. But yeah guys, I'll see you in the next one. Peace.